Hi guys, Dr. Jeremy Height here with Pinnacle Chiropractic and Rehab, and this week I wanted to discuss some of the exercises that we can do to avoid softball injuries. I see a lot of patients that come in and they're dealing with shoulder injuries, they're dealing with hamstring pulls, groin pulls, sometimes the ab muscles can kind of get us, and I think there's some nice, easy, simple things that patients can do either in the off season or throughout the season really to decrease their chance of injury. The first exercise would be taking about a 5-pound, 8-pound weight. And what we're going to do is we're going to do some strengthening of one of the rotator cuff muscles here. What we're going to do is go at about a 45-degree angle away from our body and just slowly lower that weight down, strengthening one of the rotator cuff muscles. The next exercise would be on our side, whatever side we're throwing with typically. We're going to lay on our side, keep that elbow tucked, and we're going to go up into this position right here, slowly lowering that weight down, strengthening another one of this actually gets 2 of the rotator cuff muscles. And then we're going to go with another exercise straight ahead, and we're going to slowly lower that down in this position right here, bring it straight up overhead, slowly lowering down in that position right here. I like to work our way up to 3 sets of 10. I'm just using a 5-pound weight here. Usually if I'm working out, I'll use about an 8-pound weight. Sometimes we can get up to 10 pounds, but usually that 8-pound weight is more than enough. So softball, golf, they're rotational sports. So one other exercise that we can use a medicine ball on our back. And what we're going to be doing with this one is bringing our legs up and then doing some rotational movements with this. So a great ab exercise. Another exercise that I really like is bicycle kicks, kind of coming out into this position where we can really start improving the rotation and the strength of the ab muscles. The other exercises that I really like, we're going to switch over to the chair right here. I see way too many patients coming in with the hamstring, with the groin injuries, is just getting into lunges, and we can do squats too, where we're just kind of coming down in this position. I really like getting into a lunge position, getting onto one leg. We can start just with no weights on both sides right here, going left and right, just to develop that strength. And we can also do side lunges where we're going to the side, strengthening some of that groin muscle. As we build up and as we're kind of getting into it, and then we can start adding weights. I have 8-pound weights here, but a lot of times I'll go about a 20-pound weight, 25-pound weight, and adding lunges to strengthen those muscles. Especially when we, a lot of times patients or people warm up playing softball and then they don't go run for, 15, 20 minutes, and then they go run hard to first base or whatever it is and end up with a hamstring injury. So lunges are a great exercise really to get the leg strength in there. These are kind of the beginning set of exercises that we can do. If we're looking for performance, there's a whole nother set that we can go with. We can get into a little bit heavier weight. We can get in some power, strengthening as far as sprinting goes, and kind of getting the tendons adapted there. And then also kind of doing some plyometrics or some jumping to start loading those tendons up. So these exercises are kind of more that baseline that almost everybody that's playing softball should actually be doing some of this in the off season to help decrease chance of injury. All right, have a good rest of your week.